Welcome. Welcome to this introduction to using guided meditation to help manage menopausal symptoms. This is one of a series of online courses developed by Wellbeing Therapies by Fiona. I really hope it helps and I hope that you enjoy the short course. Thank you. This introductory course aims to give you knowledge about what's going on in your body physically during the menopause and to help you to begin to understand the connection between these physical changes and your mental well-being. You're going to gain an understanding of how the human brain works and the impact we can all have on our mental health by using some simple techniques that can and do improve how you feel physically and emotionally. As part of this course, you're going to experience a guided imagery session so that you can understand firsthand just how this can be such an important support to help you deal with the challenges you may be going through during the menopause. Hi, my name is Fiona. I thought it might be helpful for you to get to know a little bit about me first of all. I've always been interested in the connection between our mental and physical health. I run a busy practice that involves both psychological and physical therapies. A combination of these therapies helps support my clients' well-being. I combine counselling, hypnotherapy and complementary therapies to support the clients I see, helping them make the changes to their lives, which are both positive and for some people life-changing. I offer support in relation to stress and anxiety management, about loss and bereavement, as well as people making lifestyle changes in relation to eating, exercise or addictions. Many of the women I have supported in the past have come to me for help with menopausal symptoms, and I've worked with them to help them improve their physical and emotional well-being through the therapies I provide. I know personally firsthand that these therapies that I'm talking to you about have helped me manage and cope with some of the symptoms I've experienced during the menopause. I can honestly say that they have helped me move forward much more positively with my own life. Everyone is different, and yet as women we all share many common experiences, and 99% of us will go through the menopause at some point in our life. For some, the menopause can happen suddenly and quickly, and can happen at a very young age as a result of medical treatment, cancer, or a side effect of other surgery you might have had. For others, it can be a slow, gradual process with few symptoms. For some women, it can feel like a bereavement or a loss of our femininity and attractiveness, and also a loss of the life we've had before. For many women, it's a time to reflect on the life choices we have made, including having or not having children. Some of us feel distraught with the physical changes we see, and we can lose our confidence very quickly. Some of us accept the changes, and indeed some women welcome these changes with a feeling of relief. And for others, we might feel fragile and vulnerable at this stage of our lives. Everyone has their own story. Menopause affects every woman at a particular stage of her life. You're generally defined as going through the menopause when you don't have a period for around 12 months. Most women generally start the menopause in their late 40s or early 50s. Just before the menopause is a stage called perimenopause, and this can be when most of the symptoms are experienced. It can result in significant decreases in the production of estrogen and progesterone in the female ovaries. Despite what you may have been told, going through the menopause can and does affect every part of you, including obviously your reproductive system, but it can also affect your heart, your urinary tract. It can affect your bones, your blood vessels, your skin, your mucous membranes, your hair. It can alter your emotional state, and changes happen within the brain. So the impact is not just physical, it can also have an impact on your emotional health. So what can happen to us during the menopause? We can all relate to some or all of the symptoms which I'm going to cover now. Hot flashes or hot flushes, these are the most common symptoms that women experience. That sudden sensation of heat, either in the upper part of the body or the whole of it. This can last between 30 seconds, and for some women it could be 10 or 15 minutes. These flashes are very unpleasant, and it's not just that you get red in the face. My own experience of hot flushes is that I could be drenched right down to my underwear within a matter of seconds. Vaginal dryness is also reported by many women, and this is due to lowered secretion of estrogen and progesterone and how it affects the vagina's thin layer of moisture. A lack of these hormones cause the vaginal walls to become dry. This can make sex painful and induces an urge to urinate often. Other signs of vaginal dryness include burning, stinging or itching sensations around the vulva area. This can make it quite uncomfortable to walk, and you just feel like your body's not your own. Many women report problems with sleep. This can be either waking up earlier in the morning or having trouble falling asleep in the first place. Also, staying asleep for the whole night is very difficult, especially if you're having hot flashes. Some women develop chronic insomnia, and these unfortunately are some of the signs of the menopause setting in. In the absence of a minimum of 6 or 8 hours sleep every night, other menopausal signs like irritability and mood swings are exaggerated, not surprising if we haven't had any sleep. Urinary problems and urinary incontinence is also quite a common area which women experience, and this means a loss of bladder control. It can also mean the urge to urinate when the bladder is not full is present, and sometimes there's pain during urination. The common cause of these problems is the thinning of the vaginal and urethral tissues and linings. Some menopausal women experience a decrease in sexual desire, and this is a result of reduced estrogen production, which causes physical changes like deferred clitoral reaction time, vaginal dryness, and slow or non-existent orgasms. Other menopause symptoms like hot flashes, vaginal dryness, and mood swings all can have a negative impact on a menopausal woman's libido. Vaginal atrophy is another area which I believe isn't spoken about very much, and this is a result of lowered estrogen production. Vaginal atrophy is when the vaginal walls undergo inflammation and they begin to thin. As a result, women with vaginal atrophy experience pain during sex, which causes them to lose interest in sexual intercourse. Unfortunately, this can be a terrible side effect of some chemotherapy and radiotherapy treatments. Depression can be experienced by some women, and this is due to the changes and disruptions in the hormone production in the body. These disruptions tend to alter the mood of many women. Feelings of depression, irritability and mood swings are fairly common. In fact, going from extreme highs to severe lows in a very short space of time is pretty common. This is one of the symptoms that I experienced. One minute I'd be laughing and the next minute I'd be in tears. Skin and hair changes are talked about a lot by women, and this is because there's lower levels of estrogen causing hair loss or to make your hair feel too dry or too brittle. With age, a woman also loses collagen and fatty tissue, which causes the skin to go dry and thin. This also affects the elasticity and moisture content of the skin, especially in the vaginal and urinary tract areas. For me, I know one of the symptoms I had, which I had not associated with menopause, was bone pain. And in particular, I had very painful feet, which at times made walking very difficult. I felt like I had turned into an old lady overnight. I was so tired, so irritable, and I found it hard to concentrate on anything. I've always been a slightly clumsy person, but during the menopause, I was constantly dropping things, forgetting things, and feeling in a muddle and quite stressed. This was made much worse by feeling I couldn't talk about what I was going through, either to my work colleagues or my friends. And I could hear people making jokes about it just being my age, which was quite alienating, and it made me feel very lonely. I just tried to get on with it, and I kept quiet. But I knew that I was losing my confidence, and I was worried about my health and some of the symptoms I had. Unfortunately, I didn't go to speak to anyone about it until probably a year after the main symptoms emerged. In hindsight, I wish I had gone earlier, because there is help out there for us all. One of the symptoms of menopause, which I find very surprising, that does actually have scientific fact behind it, is our brain fog. Yes, there really are changes that happen in the brain during the perimenopause phase and postmenopausally. There are electrical changes that happen in the brain because of all the changes to our hormone levels, and the changes result in different moods, emotions and feelings during this phase of our lives. Did you know that menopausal symptoms are much more common and much more prevalent amongst women living in the West compared to other parts of the world? Many psychologists and scientists have been trying to discover why this is the case. They believe that the mental attitude towards the menopause is a very important and marked difference between different cultures. When older women are more respected and valued for their wisdom, the attitude to the menopause is a much more positive one within communities, and as a result, women experience far fewer symptoms. So I am not a doctor, nor am I a specialist in menopause, so I cannot and would not give you any advice about what is right for you. But all I can say is do not sit in silence, putting up with the symptoms that can often be debilitating, painful, distressing, and can just make you feel awful. This is not about surviving the menopause, it's about finding out what works for you by exploring all the alternatives out there. So whether you decide to seek medical advice, try different herbal remedies, change your diet, or experiment with complementary therapies, there are many things out there that can and do help all of us cope with the changes, and they can help us regain that strong, confident feeling that we used to have before as women. As I said, I'm not here to tell you what to do, but there is some general advice out there. Advice to exercise regularly, to eat a healthy diet, to keep well hydrated, and to watch what your body mass index is, to keep to a healthy weight for the size and type of body you have. But yes, I know it's easier said than done when you're feeling low, you feel exhausted, you're not sleeping properly, and your confidence is being eroded. The next part of this training is for you to experience a skill that is easy to learn, and you can apply it every single day. It doesn't need specialist equipment, you don't need to go to the gym. You can do this at work, at home, in the garden, or anywhere where you can sit or lie down just for 5, 10 or 15 minutes where you won't be disturbed. I promise you it really helps you feel less stressed, can really help with sleep problems and reduce the hot sweats, that panicky feeling, and quieten any negative thoughts you might have. So how do you develop a more positive mindset to help you manage the symptoms of menopause? Well, getting into a more relaxed state of mind is what I'm going to show you how to do. This is too simple. What difference possibly could that make, I hear you say? Well, there is clear evidence that adopting these routines to your daily activities can and do make a difference to the physical as well as mental symptoms you have. It takes practice. It's not a magic wand. You need to commit yourself to putting yourself first and having these practices as part of your daily routines. Making a decision about what you want to do can feel scary. And if it makes me worse, what do I do then? And what if it doesn't help? What if it costs too much? And what if I lose even more confidence? What if I gain weight or my moods get worse? There are so many reasons we conjure up within our own minds that prevent us from trying different things. Getting to a place where you feel able to make decisions to move forward, and this can often begin with your own mindset. Getting into a positive state of mind about all the changes happening to you is such an important first step. So how come guided meditation or hypnotherapy can help with your symptoms, you say? Well, the human mind is very complex, and when we experience and believe in something vividly within our minds, the body always follows the mind. So even if we only imagine something, we can have a physical response. I know that if I just think about looking over a high building to a drop below, my stomach rolls over and I feel sick. I know I'm not there in a tall building, but I can imagine it and I still get the physical responses. We have two body systems, one called the sympathetic system and one called the parasympathetic system. When we feel positive, comfortable and relaxed, we activate the left hemisphere of the brain. This part of the brain controls the parasympathetic system of the body, and this directly impacts on physical changes to the body. It controls and makes muscles relax. It slows the heart rate down. It dilates our blood vessels and it helps to slow our breathing. In contrast, if we're stressed, we're worried or scared, the right side of our brain is stimulated, and this controls what's called the sympathetic system. The sympathetic system is involved in the stress response, that fight, flight or freeze response. It releases hormones that help us deal with a physical or psychological threat. I know that when I get a hot flush, I feel a panic rise in my chest, and I know for a fact that my heart starts to race faster. I worry what I look like. I think I'm going to look a fool with my bright red face. I'm soaked and I think everyone's looking at me. I feel more and more panicky, and this makes the hot flush get much worse and I simply want to run away. So the simple process of having a hot flush for me basically triggers the sympathetic system, and before you know it, I've got a full-blown panic attack happening. When you use your mind to control your breathing, consciously slowing your breathing down, consciously thinking of a calm and peaceful place, imagining it very vividly, we kickstart the parasympathetic system. And the wonderful thing is that we cannot feel panicky and calm at the same time. This process of inducing calmness reduces the flow of chemicals relating to that stress response in the body. Our heart rate reduces and the physical symptoms will begin to diminish. Learning this technique will not stop the symptoms of hot flushes and panic that you may have during the menopause, but they will help you reduce their intensity and the length of time that they last for. It takes practice, but you'll find it gets easier and easier every time you practice it. So why guided meditation or hypnotherapy? We call them all different names: mindfulness, meditation, hypnosis, trance-like states. They are all essentially designed to help us get into a more relaxed state of mind. We all go in and out of a trance-like state throughout the day. This is a perfectly normal state as a human being. When you become more relaxed, you are more open to seeing things differently, and the chemical balance and electrical activity in the brain actually alters. It's a fact that changes take place in brainwave activity during meditation or hypnosis, and these are confirmed by a machine called an electroencephalogram. When you're alert and conscious, you mainly have what's called beta brain waves. When you're in a light state of hypnosis or trance or meditation, your brain waves slow down and alpha brain waves are more prevalent. When you're in a deeper hypnotic or meditative state, your brain waves slow all the way down to what's called theta waves. These waves are associated with your subconscious mind, and this is where we hold learned behaviour, past experience and unconscious thoughts. When we are in our slowest, deepest state of rest, our brain waves change to delta waves. This happens when we're asleep and during very deep hypnosis. Alpha and theta brainwaves are the ones most associated with meditative clients, and when in this mental state we can much more easily transfer knowledge to the unconscious mind, ready to influence the conscious mind in our everyday awakenings. So, you're in your own world when you feel so relaxed and so calm. You can imagine things differently, and you're free from people and yourself prejudging what you should think or what you should feel within your body. You are solely focused on one thing, and you've blocked everything else out. And when you're in this meditative state, you can accept changes in terms of how you see things and how you cope differently. You can suspend logical beliefs that you may have imprinted on your subconscious mind from experiences before, from parents, from teachers or peers. In this mental state, you can accept a different reality, even if this goes against everything you've been taught and experienced before. It can also help you deal with outside negative responses to your menopausal symptoms, those feelings of embarrassment or stress. It can be extremely helpful for you adopting a different view of your symptoms and the process that you're going through. How you understand how guided meditation, vivid imagery, hypnotherapy, and all those other terms can help you enter a calm state of mind, and that you can change your physical and mental state. And by doing so, how this can help alleviate some of your menopausal symptoms and put you in a positive state of mind to see and cope with these changes differently. So the next part of the course, you are going to learn 2 new skills. One is called progressive muscular relaxation. This is a technique used by many therapists and counsellors. This is to help you physically relax so that you're able to access different parts of your brain and to help kickstart the parasympathetic nervous system. The next skill you'll learn is called mental imagery, and in this session you're going to learn how to visualize a cool breeze, which can be very beneficial for those of us experiencing hot flushes or a feeling of panic or anxiety. So this part of the course is your opportunity to experience firsthand a guided imagery session. This is specifically designed to help you feel more peaceful and relaxed. So remember what you've already learned. The mind cannot distinguish between what is real and what is vividly imagined. By imagining you are calm in your mind, the body quickly follows, and it can become more relaxed and much more calm. This can help you lower your blood pressure, can help reduce the feelings of anxiety or stress, and all of these physical responses can and do help alter your physical state and your emotional state. Remember, you alter your brainwave activity, and as a result, you're able to see and feel things differently. So get yourself nice and comfortable, turn off any devices that you don't need, let others know that you need just 15 minutes of peace and quiet, and then let's begin the session. So let's begin. Begin by breathing in and holding for a count of 3. And then breathe out. Each time you breathe in, you hold for a count of 3, and then you breathe out. And with each breath you take in, you bring in positive, warm feelings, and every time you breathe out, you let all those tensions in your body just drift away. And when you breathe in, you imagine you're breathing in calmness, relaxation, and peacefulness. And every time you breathe out any tensions, any tightness, any anxieties or worries or things that may have been on your mind. You just let them go as you breathe out. And you can already feel the physical body beginning to relax. You focus on the area around the top of your head. Feel the temperature around your head. Feel the surface that you're leaning against. Notice all those little things. Now begin by imagining a peaceful, warm and comfortable feeling all around the top of your head. Waves of relaxation begin to move down from the top of your head, down the back of your neck, all those tensions beginning to drift away, feeling so calm, so relaxed. Those waves of relaxation now flow over your face, just lengthening, loosening and softening all those muscles in your face. Feel the waves of relaxation now really begin to wrap around your shoulders, just allowing those shoulders to drop just a little, feeling calm and peaceful and very comfortable. Waves of relaxation now, starting at the top of your head, flowing over your face, around your neck and sliding over your shoulders and heading down towards your back. Waves of relaxation. You are in control. You decide just how relaxed you want to be. Allow those waves of relaxation now to flow all the way down your back. Feel them wrap around your waist. Waves of relaxation from the top of your head, sliding gently over your face and neck. Waves of relaxation all the way down your back, wrapping around your chest and stomach now. Feel the waves of relaxation from the top of your head, sliding all the way down your shoulders, all the way down your arms, lengthening, loosening and softening all those muscles. You notice how your hands are already beginning to relax. Waves of relaxation from the top of your head, sliding down your face and neck, all the way down your back, so calm, so peaceful and relaxed. Waves of relaxation now flowing down your arms all the way to the tips of your fingers, softening, relaxing, very peaceful. Now feel those waves of relaxation now flowing from the top of your head all the way down your back, all the way over your hips now, sliding down your thighs, softening, relaxing, very calm. Waves of relaxation now from the top of your head all the way down your chest, past your hips and right the way down towards your knees, so calm and peaceful, very comfortable. Waves of relaxation now from the top of your head all the way down towards your knees, flowing calm and warm, very comfortable. Waves of relaxation now, softening all those muscles around your knees, sliding that relaxation now down towards your feet. Notice how every muscle now feels so relaxed. Just allow your body to sink into the bed or chair that you're resting on. Feel yourself letting go just that little bit more. Waves of relaxation now from the top of your head, flowing over your shoulders, heading towards your feet. Notice how calm and soft your feet are now. So very comfortable, very calm and peaceful. Notice how each tiny little muscle around your ankles, your feet and every toe just relaxes, softens. Any tensions just drift away. Now feel the waves of relaxation now starting at your feet and flowing all the way up your body, flowing all the way to the top of your head, so calm, so peaceful and relaxed. Notice the waves of relaxation now flowing from the top of your head all the way down your body towards your feet. Allow these waves of relaxation now to come from the bottom of your feet all the way towards the top of your head. So peaceful and calm, very comfortable. No one wants anything from you, no one needs anything. This is your time to feel peaceful and calm. Feel how still you feel within your body. Feel how calm you feel within your mind. Just enjoy these feelings for a moment while I'm quiet. You know already how powerful your own mind is. You know that when you imagine things, you have physical responses to those imaginings. Visualization can help us control our emotions and the chemicals within inside our body. Not because I say so, but because you really want to feel better and enjoy your life and your health and fill it with meaning and purpose. There's been occasional times when you felt overwhelmed with those old symptoms of menopause returning. But with the use of relaxation and calmness, you can be the mistress of your own body. So allow yourself to drift just a little further into a calm and peaceful feeling. You know that you can instantly reawaken if you need to, if something urgent needs your attention. But otherwise you're happy to be calm and quiet and peaceful here. Outside sounds or movements can just dissolve away into nothingness. Accept this wonderful feeling that you're beginning to experience. We all know that the symptoms of menopause vary from woman to woman. But the reason these symptoms, as you already know, are variations in them, is the release of chemicals into the body, mainly the hormones estrogen and progesterone. They are produced in your ovaries and they're regulated by a tiny gland called the Pituitary Gland, which is situated within your brain. I want you now to visualize your own brain. And I wonder if you can imagine your pituitary gland now. It's a small, roundish organ that lies immediately beneath the hypothalamus, resting in a depression at the base of your skull. It looks something like a small bean, but it's no larger than a pea. The pituitary gland itself is controlled by the hypothalamus, to which it's attached by many nerve fibers. The whole system may look like a network of interconnecting wires, or the underground map of a railway system, or anything in fact that helps you communicate between your own mind, between the hypothalamus, the pituitary gland and your ovaries. Imagine that network of interconnecting wires. Use your own imagination to imagine it right now. because it can only be right if you have created it. I'd like you to see or sense, or yourself as you will, someone who is totally in control of regulation of the production of hormones. And you're tracing that network to the source of your symptoms. When you've located an area where malfunction seems to be taking place, it doesn't matter how it appears to you right now. You may just know that this is the place in your subconscious mind has directed you to it. So when you're there, and whatever needs to be done to fix this problem once and for all, you are ready and you know exactly what to do. You might find that the production of hormones needs to be more balanced in some way. If this is so, then you also know that you can regulate the production until your body is beginning to adjust and work healthily in a way that's acceptable to you. You can experiment with the controls using your imagination. And this is a way that your subconscious mind can really work for you and benefit your health. Now, using the power of your mind, adjust the flow of capillaries to your skin that make you feel hot and flushed. You recognize this feeling already, so imagine that you are adjusting the controls. You're adjusting the control to actually make you feel hot and flushed right now, and as you do this, you may find your skin tingling slightly as it begins to redden and warm. You may notice that it's like sitting in front of a hot oven or a hot coal fire. You can see the red and yellow flames dancing and warming your skin. Yes, you're beginning to feel warm now, spreading all over your body, making you actually feel as though you're having a hot flush. Good. Now you know that you caused this feeling to occur in your body, and because your subconscious mind can do this, it can also reverse the process. This is the procedure that you're going to use should you ever feel a hot flush coming over you at any time in the future. I want you to go deep inside yourself again and adjust the controls, but this time in the opposite direction to make you feel cooler and more comfortable. And as you do this, it's almost as though a lovely, cool, slightly cold breeze is wafting over your face and neck. A cool, slightly cold, cooling breeze that begins to spread throughout your entire body, making you feel cool and comfortable, making you feel good once more. You can feel this wonderful feeling whenever you need it. Just imagine that you're standing outside, perhaps on a winter's evening, watching the trees sway in the breeze, looking at the ground which is slightly frozen. Everything looks still and white around you. Perhaps there's a little rain in the air, wetting your skin and cooling you right down. In the future, if you experience these old feelings again, I want you to find a comfortable place to relax and breathe slowly and regularly, taking yourself down quickly into a lovely, calm and peaceful feeling once more. Imagine you're walking down a short flight of stairs, just 10 steps leading gently down, and count them off slowly one by one in your mind. And when you reach the bottom of the stairs, you take yourself outside into that lovely cold winter evening with a cool breeze and perhaps some gentle cold rain on your face, and you experience it once again, the coolness, the coldness spreading throughout your whole body. And you'll find that you instantly become more comfortable, so relaxed, so comfortable and calm. And when you're ready to return to full normal conscious awakening, simply bring these good feelings back with you and count yourself up from 1 to 5. You're going to practice this technique every day until the process becomes so easy that you can just think in your mind those key words, cool breeze, and you'll immediately feel the cool breeze on your skin, gently spreading all over your body and making you feel cool, calm and comfortable. Cool breeze. Cool breeze is now firmly embedded in your own subconscious mind. That lovely, cool, refreshing breeze. And the more and more you practice this, the more effective it becomes. So always remember your key words, cool breeze. And you'll feel the effects of that cool breeze whenever you need it. And now I'm going to bring you back to full conscious awakening. You're going to feel wide awake, feeling refreshed and rested. You will feel how good it feels to feel calmer and to have enjoyed some time just to focus on your own well-being. I'm going to begin counting now from 1 to 5. When I reach 5, you'll be fully awake and alert. 1, 2, you can feel the surface that you're resting on. 3, you're halfway there now. 4, already your eyes are beginning to open. And 5, wide awake, alert, back to full conscious awakening. I really hope you've enjoyed this short course. I've got more courses going to be advertised over the coming months, and I really hope that you'd like to take part in them. You can always visit my website, wellbeingtherapiesbyfiona.co.uk, and on this site you can access lots of free self-help materials, lots more therapy sessions and recordings that you can enjoy in the privacy of your own home. I work with clients from all over the country, and they are making very positive changes to their lives. So whatever the issue is that you want to work on, whether it's anxiety or stress or improving relationships, just check out my YouTube channel. There's lots of very useful videos there that might just help you overcome some of the obstacles you have in your life. Please remember, if you are looking for someone who's a practitioner, always make sure they're registered, insured and qualified. To find your local hypnotherapist, just visit the National Hypnotherapy Society website and they will be able to find you a therapist in your own local area. It's been lovely spending some time with you and I wish you all well. Bye.